Hi, I'm Heather Chumley. I'm with Charleston Therapeutic Yoga in Charleston, South Carolina. And I wanted to share with you the reason why we use supported bridge. Supported bridge is offered in many classes. I've done it 100 times in yoga classes. I love it because I love back bends. It feels really good to my body. But why are we doing it? So this is particularly important for pre and postnatal patients, because what supported bridge does, if you place the block directly under your sacrum and if you are able to relax, is that it offers an adjustment to your sacrum. It balances the sacrum left and right. So when we are pregnant, when we are menstruating, our body releases hormones that causes our ligaments to become lax. And often during those times, our innominate, our hips, can shift in one direction or the other, causing back pain. Or we can get a sacral nutation, a rotation of the sacrum. I actually had to do this morning because postnatal goes way beyond. It's not a specific time period. It's any time after you've had a child, because your hips have expanded and shifted. And no matter how strong you are, because you can become very strong through your yoga practice, there are times, for instance, I have had strep throat for the past 3 days. I've been in bed and my back got quite sore. And without the normal routine, my sacrum shifted a bit. So this morning I came into the office and this is exactly what I did. It reset my sacrum. I feel wonderful now. I can move through the rest of my day without having back issues or hip problems. So I want to share this with you because it is a really nice and quick adjustment to your sacrum. So those of you who may have this issue or think it's your issue, I highly recommend that you see a physical therapist, because even one visit can show you what exactly is going on. This may not be your issue. So before you go directly to this treatment, seek out a PT yoga therapist and see if this is your issue and if this is a treatment appropriate for you. Now, if you don't have back issues, this is a really nice way to restoratively open up your spine and relax your back so that you can gain a little bit more range of motion in your spine. So restorative bridge pose. You're going to come onto your back with your knees bent. And just lay flat on the ground. Let your palms face up, roll your shoulder blades under you slightly. You're going to take the block, and the block has 3 sides, so you can use it any way you need it. Now for me, I use this way when I do this adjustment. I don't use the high side, even though I use the high side for my stretches and range of motion stretch. So for example, I can lift up, use the high side just to stretch, but I like having a more flat surface for the adjustment. So I will use this side. I'm going to place it right underneath my sacrum. Good. So right there, I can feel my sacrum is supported on both sides. Your sacrum being your tailbone. It is right below your spine on either side of your hips. And then the goal is to breathe deeply. This is a nice place to practice your deep belly breathing because you can see your belly, you can see your chest. So increasing your intra-abdominal pressure, providing a gentle traction to your spine. And it may take a little while to feel. Now for me, this happens in seconds now. But for most people, you're going to need to relax a little bit. Give your body time to let go of any muscle tension, any holding in the hips. And once you can really relax over that block, you may feel a little pop, a little snap. And so when you're done, you want to gently press into your heels, not lift too high. Remove the block and roll down very slowly. And then rest there for a moment, allowing your spine to reset. Having a neutral spine here. So not too much anterior tilt, not too much posterior tilt. Finding a neutral spine. And then roll onto your side, log rolling. so as not to move the sacrum again. Push up with your hands. So if you're having problems during pregnancy, after pregnancy, I really suggest that you go see a physical therapist who specializes in yoga therapy, women's health, because just don't live with the pain. The pain can really be corrected in 1 to 2 visits. If you have any questions, please leave comments, and I will talk to you soon. Namaste.